Hi, my name is Dr. Truong. Thank you for watching this video. I'd like to introduce you to a very special form of care that a lot of people don't know about that can have a very positive effect on your health, and that is upper cervical health care. My office, what I focus on and what I specialize in is the upper neck area, which comprises of the atlas and the axis. Those two top bones are vulnerable to being shifted out of position due to traumatic experiences in their lives, like a car accident, like a sports injury, or a concussion to the head, which can have serious adverse effects on their entire body. Now, some of us have not had those experiences, which is awesome. That's great. However, there is one experience that we tend to overlook, and that has to do with the birthing process. Now, research has found that 80 to 90% of birth delivery happens to be quite traumatic. When the doctor takes the baby out, he has to turn the baby's head to one side and then pull on the neck to extract the baby. And that particular experience can be quite traumatic to that upper neck area, because when that bone shifts out of place, it stays out of place, unfortunately, because there's a lot of muscles in your neck. There's about 16 muscles in your neck that keeps it out of place. And it causes nerve pressure at that area, and it limits the ability of the brain to talk to the body. So you have to wonder, well, how well does my body function then if there's poor communication between the brain and the body? I would imagine it's probably not going to work very well if the brain is not able to talk to the body effectively. And what I mean by that is that the messages from the brain to the body, because of that nerve pressure there, is going to be muffled. So if the brain were to tell the body to digest the food, and it just says, go to digest the food, or, send out gastric, it's muffled. And the body may pick that information up, it may not. And also, it adds to another problem, is that then the body has to interpret what the brain's trying to tell it to do, and that leads to dysfunction, unfortunately. So the brain is a very powerful organ in your body. I think we all can relate with that. Without our brain, we cannot think, obviously. We cannot breathe. We cannot walk. We cannot control our normally daily functions that we take for granted. So the brain is a very vital organ in your body that controls every aspect, every cell in your body. But it has a limitation. And that limitation is the brainstem. The brainstem itself, which is this red area here, is an extension of that brain. It allows the brain to talk to the body. And unfortunately, because the brainstem is sitting around the neck area, especially the atlas and the axis, that area is highly vulnerable to being shifted out of position. Now, as you can see, the brain is well protected. There's a vault. It's actually protected by a really nice vault. There's not a lot of moving parts. And so you literally have a helmet that's protecting your brain, so your brain has no problem. But as you can see, the extension of the brain through this opening here, which is the brainstem area, is highly vulnerable to problems, having nerve pressure at that particular area. And what it does when this scenario happens, when the bone is out of place, it limits the ability of the brain to talk to the body due to the fact that nerves are being crushed. Nerves are being damaged and bruised due to this bone shifting out of position. So when that happens, it develops a situation where there's a disconnect between the brain and the body. And that's not good. And now, what are some of the functions, vital functions of the brainstem? Well, we can learn from a very important figure that we all can know, which is Christopher Reeves, Superman. When he fell off that horse, one of his main complaints that he mentioned in the newspaper article was the fact that he could not breathe. That was one of his main challenges when he fell off that horse. And in fact, the brainstem actually has a very special center called the apneusic center that controls breathing naturally. So you can imagine if there's a injury here or an interference at the brainstem area, it limits the ability of the brain to tell the lungs to contract and expand and contract and expand so that you can have full breathing. So it limits that ability, so it affects your breathing. And I find it to be true with a lot of my patients. When I give them the upper cervical correction and free up that nerve area, their breathing returns to full potential. And they notice oxygen returns to the body, they feel much better, much more clarity is achieved through this particular care. The brainstem also controls blood pressure. There's actually a study on how an upper cervical correction can help lower blood pressure. And they found that on average, a person that is that's under upper cervical care actually sees a drop of average of 17 points in their systolic blood pressure. And they found that that's equivalent to 2 blood pressure medications. So it's very powerful. And the reason why this particular area has such a positive effect on blood pressure is because the fact that this particular area controls a very important automatic part of your nervous system, which is the parasympathetic nervous system. And that parasympathetic nervous system is like a braking system in your body. It helps slow things down a little bit for you. It helps put you at ease. Because in our society, we have an overdrive of the other part of the automatic nervous system, which is the sympathetic nervous system, which I don't want to get into too much. But it's sort of the go, go, go mentality of, I got to do this, I got to do that, I got deadlines. So it really stresses you out. So this particular area actually regulates or allows the expression of the parasympathetic nervous system, which slows things down for you. It allows the digestive part of your body, the digestive system, to work freely, so that it doesn't get compromised, and it works to its full potential, so that you can absorb the food you're eating. Because unfortunately, if you are on this sympathetic overdrive, it's really hard to digest food, obviously. Just like if a bear were to run towards you, you don't stand around and just digest food, you run. So that's part of the sympathetic nervous system, and this particular area helps counter that, and it helps relax you, and it actually has a positive effect on the diameter of your blood vessels. If this particular area is working properly, the parasympathetic nervous system, what happens is your blood vessels start to dilate and to relax. And so you can see the amount of blood flow through that particular opening is much better. But if your parasympathetic nervous system is not working very well, what happens is the sympathetic nervous system, which is the opposite of this particular system, causes a constriction of the blood vessels, and it actually causes a spike in your blood pressure. So that's why this particular area has such a profound effect on your blood pressure. Now, if you're interested in learning more about this particular care, this special upper cervical care, I would recommend that you actually visit my website, and the address is www.drtruong.com. Doctor is spelled out D-O-C-T-O-R, Truong.com, and so that you can learn more information about it. And we do welcome new patients, and if you're interested, please call and schedule an appointment. My name again is Dr. Johnny Truong. I am a brainstem specialist. Thank you.